when we talk about healthcare and the military, in this country, we do not do things cheap. I will say this. These are two of the biggest items on the budget. Military spending is 19% of the federal government budget, and that's only the Defense Department. That doesn't include the visible and invisible but extremely large national security apparatus that exists outside of the Defense Department's budget. So we have 19% plus of spending at the government level going into the military. What are we getting? How effective are we being with that expenditure? We will talk about that in this hour. And what might we do differently? Now, another huge item is health care. That, in terms of our national GDP, we spend more on health care than any other developed country. We spend 17.2% of our GDP on health care. But what are we getting for our money? The answer is not much. We still have far more people with no health insurance at all than comparable countries do. And studies have shown that people are paying more out of pocket than in most cases. People are struggling financially to meet these expenses, and we have a system that leaves people doing without needed medical services because they can't afford the out-of-pocket cost, even when they do have health insurance. Now, many people have celebrated, in my belief, wrongly, the fact that the rate of inflation for healthcare spending in this country has lowered somewhat. That is, of course, good news, but we are still spending far too much. And the amount of that dollar, that healthcare dollar that comes out of an individual's pocket as opposed to their employer, is going up every year. Milliman, highly respected actuarial firm, reports on these findings every year. Their key findings for 2015 for the U.S. healthcare budget for the cost for a family of four with good health insurance was growth rate was up, mostly due to prescription drug prices. Big pharma is out of control in this country. And in fact, the costs were 5.4% for a family of four, meaning that the total cost of providing moderate, okay, mediocre PPO coverage to a family of four is now $24,671 on average. Pharmaceutical costs spiked. The so-called Cadillac tax on higher cost benefit plans, which some of us opposed, but which the president supported, is probably going to start making those costs go up even further. And as Milliman found, employees continue to shoulder an increasing percentage of healthcare expenses. The total employee costs, that includes payroll deductions for premiums and out-of-pocket costs, increased by 43%, an approximate 43% between 2010 and 2015. If Americans don't feel our healthcare system is working, even after Obamacare, that is why. That is why calls for Medicare for all, for once and for all, to give it to the part of the economy that can do it most efficiently, which is to say the public sector must be heeded. Obamacare may be an improvement and is an improvement for some, but we still urgently need Medicare for all. I will be back after this with our guests. I'm Richard RJ Eskow, and this is The Zero Hour.